What's the difference between NEC and NOS? NEC means not elsewhere classified. This is the same as other specified. This designation means that the physician provided details and specifics about this diagnosis that are not included in the description of any other code. For example, Dr. Moss writes that the patient has infection C. In the code book, there is a specific code for infection A and infection B. Then there is a code for infection NEC, or it might say other specified infection. You would report the code for infection NEC or other specified infection because the code reporting infection A would not be true. The code for infection B would not be true. And you need to report the diagnosis. Therefore, the code infection NEC or other specified infection is your only choice to accurately report this diagnosis according to what the physician wrote, because the physician did, in fact, specify an infection, just not the one with a code. NOS means not otherwise specified. This is the same as unspecified. This designation means that the physician did not provide the details you need to choose any other code. In real life, you should always query the physician and do not use an unspecified or NOS code. Insurance companies will rarely pay for an unspecified code. For example, if we continue using a scenario similar to the one we just mentioned, Dr. Moss writes that the patient has an infection. In the code book, there is a specific code for infection A and infection B and infection NEC or other specified infection and infection NOS unspecified. With this scenario, and no opportunity to query Dr. Moss for more specific details, you would have to report the code for infection NOS unspecified because Dr. Moss, in fact, did not specify what type of infection the patient has. If you have any questions, please ask your instructor. Use either email or the Q&A discussion forum in your course room.